Right now, as you're watching this video, measles cases are surging worldwide at rates we haven't seen in decades. What I'm about to share could literally save lives in your community. If you think measles is just a harmless childhood rash, you're about to discover why medical experts are calling this one of the most dangerous misconceptions of our time. Welcome back to Health Treatment Center, where we break down the health information that matters most to you and your family. I'm here to give you the complete truth about measles, the symptoms you need to recognize immediately, the prevention strategies that actually work, and why vaccination has become more critical than ever before. Here's something that might shock you. Measles isn't just coming back, it's coming back stronger. In 2024, we saw a 300% increase in measles cases compared to the previous year, with outbreaks hitting communities that thought they were completely safe. But here's what's even more concerning. Many parents today have never seen a case of measles, which means they don't know what to look for until it's too late. Let me tell you about Emma, a healthy 4-year-old from a loving family who thought they were doing everything right. Her parents noticed what seemed like a simple cold, runny nose, slight fever, nothing unusual, when within 72 hours, Emma was in the intensive care unit fighting for her life. What happened to Emma is happening to children across the globe, and it's completely preventable. If you've ever wondered whether measles is really that serious, type learning in the comments right now, because what you're about to discover will change how you think about this disease forever. Measles starts quietly, almost innocently. The first symptoms look exactly like a common cold or flu, which is why it's so dangerous. You'll see a runny nose, watery eyes, and a cough that seems perfectly normal. The fever usually starts low, around 101 degrees, and parents often think it's just another virus making its way through the family. But here's where measles reveals its true nature. After 2 to 4 days, something called Koplik spots appear. Tiny white spots with blue centers inside the mouth, usually on the inner cheek. Most people miss these completely because they don't know to look for them. But these spots are like measles leaving its calling card. Then comes the rash, and this is where parents realize something is seriously wrong. The measles rash doesn't start everywhere at once, begins at the hairline and behind the ears, then spreads downward across the face, neck, and eventually covers the entire body. The rash looks like flat red spots that often merge together, creating larger red blotchy areas. Unlike other childhood rashes, the measles rash has a very specific pattern and progression. Stop for a moment and think about this. How many parents do you know who could confidently identify these early warning signs? Comment below if you knew about Koplik spots before watching this video. But the visible symptoms are just the beginning. What makes measles truly dangerous is what it does inside the body that you can't see. Measles attacks the immune system in a way that's absolutely devastating. It literally erases your immune memory, wiping out protection you've built up against other diseases over years or even decades. This process, called immune amnesia, means that even after you recover from measles, you're vulnerable to infections you were previously protected against. Think about that. Measles doesn't just make you sick once, it can make you vulnerable to getting seriously ill from other diseases for months or even years afterward. Here at Health Treatment Center, we've seen the research, and it's sobering. Children who get measles are up to 5 times more likely to die from other infectious diseases in the following years, even if they fully recover from the measles itself. This isn't fear-mongering. This is medical fact backed by decades of research. The complications from measles can be severe and sometimes permanent. About 1 in 4 people who get measles will be hospitalized. 1 in 1,000 will develop brain swelling called encephalitis, which can cause permanent brain damage. And here's this statistic that should concern every parent. 1 to 2 out of every 1,000 children who get measles will die from it. If this information is opening your eyes to how serious measles really is, hit that like button to help us reach more parents who need to see this. Now let's talk about why measles is making such a dramatic comeback. The answer is both simple and complicated. In communities where vaccination rates drop below 95%, measles spreads like wildfire. Measles is one of the most contagious diseases known to humanity. If you're not immune and you're in the same room as someone with measles, there's a 90% chance you'll catch it. Think about that level of contagiousness. If someone with measles walks into a room and leaves, the virus can stay in the air for up to 2 hours, just waiting for the next unvaccinated person to breathe it in. This is why measles outbreaks can spread so quickly through schools, airports, and communities. The measles vaccine, given as part of the MMR vaccine, is incredibly effective. 2 doses provide about 97% protection against measles. But here's the critical point. For a community to be protected, we need what's called herd immunity, which requires about 95% of the population to be vaccinated. When vaccination rates drop even slightly below this threshold, measles finds the gaps and spreads rapidly through unvaccinated individuals. We've seen this pattern repeat in communities around the world. It always starts the same way. Vaccination rates slowly decline, parents become complacent, and then measles arrives and spreads faster than anyone expected. Let me share something that might surprise you. The measles vaccine isn't just one of the most effective vaccines we have. It's also one of the safest. Serious adverse reactions are extremely rare, occurring in less than 1 in a million doses. Compare that to the 1 in 4 chance of serious complications from measles itself, and the choice becomes very clear. How many of you have had concerns about vaccine safety? It's completely normal to have questions, and if you do, comment questions below, because addressing these concerns with factual information is crucial. The MMR vaccine is typically given in 2 doses, the first between 12 and 15 months of age, and the second between 4 and 6 years old. Adults who aren't sure about their vaccination status should talk to their doctor about getting vaccinated, especially if they're planning to travel internationally. For infants who are too young to be vaccinated, the protection comes from 2 sources: their mother's antibodies, if she's immune, and the vaccination of everyone around them. This is why community immunity is so important. It protects the most vulnerable members of our society. If you're planning international travel, this is especially important. Many countries are experiencing measles outbreaks right now, and airports and tourist destinations can be hotspots for transmission. Make sure your vaccinations are up to date at least 2 weeks before you travel. But prevention goes beyond just vaccination. If someone in your household has measles, isolation is critical. The infected person should stay home for at least 4 days after the rash appears, and anyone who isn't immune should avoid contact. Good hand hygiene and avoiding touching your face can help prevent the spread of many diseases, though measles spreads primarily through respiratory droplets in the air.
Active.
Here's what every parent needs to know. If you suspect measles, don't just show up at your doctor's office or emergency room. Call first. Healthcare facilities have special protocols for suspected measles cases to prevent the disease from spreading to other patients, especially those who might be immunocompromised. The diagnosis of measles requires laboratory confirmation, usually through blood tests or throat swabs. Healthcare providers are trained to recognize the characteristic rash and symptoms, but confirmation is important for public health tracking and response. Treatment for measles is primarily supportive care, fever reducers, plenty of fluids, and rest. There's no specific antiviral medication for measles, which is why prevention through vaccination is so crucial. Vitamin A supplementation is sometimes recommended, particularly for children, as it can help reduce the severity of the disease. If you're still watching, you clearly care about protecting your family's health. And that's exactly the kind of viewer we love here at Health Treatment Center. Make sure you're subscribed with notifications on, because we're constantly sharing the latest health information you need to know. Let me tell you why this matters more now than ever before. We're living in an interconnected world where diseases can spread across continents in a matter of hours. A measles outbreak in one country can quickly become a global health threat. We've seen this happen repeatedly over the past few years. Social media has also played a role in spreading misinformation about vaccines faster than accurate information can travel. Parents are being bombarded with conflicting messages, and in that confusion, some are choosing to delay or skip vaccinations entirely. This creates pockets of vulnerability that measles exploits with devastating efficiency. The COVID-19 pandemic also disrupted routine childhood vaccinations worldwide. Many children missed their scheduled immunizations, creating a generation of kids who are now vulnerable to diseases like measles. Health authorities are working to catch up, but it's going to take time and effort from everyone. Here's something I want you to remember. Choosing vaccination isn't just about protecting your own child. It's about protecting infants who are too young to be vaccinated, people undergoing cancer treatment who can't mount an immune response, and individuals with compromised immune systems who depend on the rest of us to create a protective barrier around them. Think about the most vulnerable person in your life. Maybe it's a newborn baby, an elderly grandparent, or someone fighting cancer. Our vaccination decision affects their safety too. When we vaccinate ourselves and our children, we're participating in one of the most successful public health interventions in human history. The numbers don't lie. Before the measles vaccine was introduced in 1963, measles killed about 500 people every year in the United States, most of them children. By 2000, measles was declared eliminated from the United States. But elimination doesn't mean eradication. It means the disease is no longer continuously circulating. T can still be imported from other countries, and if our vaccination rates drop, it can take hold again. This is exactly what we're seeing now. Measles has returned to communities that hadn't seen a case in decades, and it's spreading among unvaccinated children and adults. The solution is clear, effective, and readily available. If you're a parent wondering about the safety of vaccines, I understand your concerns. As a health educator here at Health Treatment Center, I've reviewed the research extensively. The scientific consensus is overwhelming. Vaccines are safe, effective, and essential for protecting public health. The risks of vaccination are minuscule compared to the risks of the diseases they prevent. For those of you who might be thinking that natural immunity is better than vaccine immunity, let me share some important facts. While natural measles infection does provide strong immunity, the cost of acquiring that immunity is enormous. Remember, measles can cause brain damage, permanent disability, and death. The vaccine provides the same protection without the devastating risks. What can you do right now? First, check your family's vaccination records. If you're not sure about your vaccination status, talk to your healthcare provider about getting tested or revaccinated. It's safe to receive additional doses of the MMR vaccine, even if you're already immune. Second, make sure your children are up to date on their vaccinations, according to the recommended schedule. If they've missed doses, work with your healthcare provider to catch up safely. Third, if you're planning to travel internationally, especially to areas with ongoing measles outbreaks, make sure you're protected at least 2 weeks before you travel. And finally, be part of the solution in your community. Support policies that maintain high vaccination rates, share accurate information about vaccines, and help create an environment where all children can be protected. What I want you to take away from this video is that measles is not a disease of the past. It's a current threat that requires our immediate attention. The tools to prevent measles are incredibly effective and readily available. The choice to use them protects not just our own families, but our entire community. Here at Health Treatment Center, we believe that informed decisions are the best decisions. That's why we're committed to providing you with accurate, science-based information about the health topics that matter most. If this video has been helpful to you, please hit that like button and share it with other parents and caregivers who need this information. Subscribe to Health Treatment Center for more essential health content and ring that notification bell so you never miss our latest videos. I want to hear from you in the comments. Have you seen measles cases in your community? Do you have questions about vaccination? What other health topics would you like us to cover? Your engagement helps us understand what information you need most, and it helps YouTube share this important content with families who need to see it. Remember, when it comes to measles, prevention isn't just the best medicine, it's the only medicine that truly works. Stay informed, stay protected, and keep your community safe. Thank you for watching Health Treatment Center. I'll see you in the next video where we continue to bring you the health information that matters most to your family's well-being.